So October is Breast Cancer Awareness Month, and there's a wealth of information about breast cancer out there. It can be extremely helpful, but all of that information can also be overwhelming.
It's a lot at one time, right? Breast cancer is not a one-size-fits-all journey. Joining us now on how to assess risk for breast cancer and why genetic testing can help with proactive and reactive care is Dr. Robert Nussbaum, Chief Medical Officer at Invitae. Doctor, thanks for being here this morning.
Thank you very much for having me.
First up here, can you tell us how people can assess their risk for breast cancer?
Well, the key issues are, first of all, their own personal medical history, because there are certain patterns that are suggestive of a hereditary increased risk for breast cancer. Family history. I cannot stress more strongly that family history is a very important area, and people should get to know their family history. Relatives are often reticent to talk about it, but your family history can be an extremely important guide to assessing one's risk for breast cancer, particularly for the genetic forms.
So with family history being so important, I guess genetic testing is wonderful in this particular part of treatment or diagnosis.
Yeah, for all of the above. So genetic testing is extremely important for diagnosis, for management, for figuring out exactly what needs to be done to help a patient who has breast cancer, and then therapy. There are certain therapies that are particularly well suited for people who have changes in the genes that predispose to breast cancer, like BRCA1 and 2.
Yeah, doctor, can you elaborate that? How can that genetic testing, that information, help inform the different types of cancer treatment?
There are genetic changes in cancers. Cancers are essentially caused by changes in the genes. And there are certain changes which render a cancer particularly susceptible to therapy with drugs such as PARP inhibitors or platinum-based therapies. And therefore, knowing the genetic makeup of the person and the genetic makeup of the tumor can be very helpful in figuring out what's the best, most precise therapy to use.
And doctor, are you saying that genetic testing is important throughout the process of dealing with cancer, or throughout that journey? In other words, the genetic test may show something at the beginning, and then throughout the middle and the end, the test comes back different.
That's a great question. The test that's done on your own sort of body's DNA, which is done on blood or saliva, that is not going to change over time. But there's also testing that's done in a tumor itself, and particularly if the tumor spreads, if it's metastatic. That kind of genetic testing can change over time and can inform your treatment.
So helpful to know that. I did not know that. I feel like a lot of people out there are unaware of that. Doctor, what advice do you have for those considering genetic testing?
First and most important is talk to your healthcare provider. Make sure that you have your own personal and family history well organized, and then discuss with them the option of having genetic testing. It's strongly recommended in all patients with ovarian cancer. It's recommended in many, if not most, patients with breast cancer. Don't ignore the fact that prostate cancer has an increased risk from exactly the same changes that cause the increased risk for breast cancer, but just in the men in your family. There's a myth that breast cancer only passes through women. This is not true. A woman can inherit a genetic change from her father that predisposes her to breast cancer.
Wow. And doctor, before you go, can you tell us a little more just about how that genetic testing works? I mean, we talked about, a swab for sort of the basic DNA kit we all get in the mail for Christmas or whatever, but is this one the same, or how does this work?
So either a blood sample that's obtained in the office or a saliva sample. We can also do it with swab. That's another possibility. But in general, we prefer either saliva, you just basically spit into a little cup, or a blood sample. They extract the hereditary material, the DNA, and they spell check it. And they look at all of the genes that predispose to breast cancer and ask the question, are they spelled properly, or is there a misspelling which causes the gene to be defective? And if that's the case, then you have a significant genetic change which will alter your therapy, your management, and that of your families.
Extremely helpful and life-saving information this morning. Thank you, Dr. Robert Nussbaum, Chief Medical Officer at Invitae. We appreciate all the info this morning.